Hello, this is my case study on gastroparesis. Evelyn, 62-year-old Caucasian female, presents with a 2-month history of nausea and vomiting. The patient stated that she has had ongoing upper abdominal pain for at least a year and has lost a significant amount of weight. Evelyn has a very small appetite and is often vomiting undigested food a few hours after eating. She has experienced episodes similar to this in previous years and has a history of hypothyroidism and hypertension. Evelyn is prescribed amlodipine, a calcium channel blocker, to treat her hypertension, which can slow gastric emptying and may be linked to her current condition. Gastroparesis can be treated by fixing the underlying cause, although the cause is not always known. It could be linked to diabetes, hypothyroidism, certain medications like calcium channel blockers, antipsychotics, or narcotics. In a lot of cases, it is diagnosed as idiopathic gastroparesis. The priority treatment, especially if we don't know the cause, is to make sure our patient is getting adequate nutrients and fluids. Some things we could suggest to our patients are to eat more nutrient-dense foods, have smaller meals more often, have a low-fiber, low-fat diet, don't lie down after eating, avoid carbonated beverages, chew slowly, and drink plenty of water. A dietitian referral would be of high importance as well. In this case, this patient has been vomiting quite a lot, so electrolyte and fluid imbalance should come into question. As the nurse, we would be administering any IV fluids that are ordered. Some other patient education is to avoid drugs, alcohol, and smoking. If gastroparesis is left untreated, food in the stomach will become hard to pass and it may not pass completely. The food left behind can turn into a hard mass called a bezoar and may cause a blockage. Gastroparesis is treated by making lifestyle and diet changes, but some medications can be prescribed to help with symptoms. One medication that is often prescribed for those with gastroparesis is metoclopramide. The classification is antiemetic, which is used to treat nausea and vomiting. The mechanism of action is it inhibits dopamine and serotonin receptors to enhance the response to acetylcholine to increase motility or contractions of the stomach and speed up gastric emptying. Common side effects include high blood pressure and diarrhea. To monitor effectiveness would be for the patient to report feeling less nauseous and hopefully is not vomiting as often. As an alternative medication, erythromycin could be prescribed. It is a prokinetic medication that induces contractions to simulate gastric emptying. However, it does become less effective over time. Some follow-up appointments you might want are to the dietitian, so they can help our patient make a meal plan that could help lessen the symptoms of their gastroparesis, but also to make sure they're still getting all the important nutrients. Lab tests and upper GI endoscopy could be ordered by their doctor just to get a better look at what's going on and to make sure there's no further complications brewing like a blockage. The doctor may also want to order a test like a scintigraphy to measure how fast the stomach is emptying and to see if the patient's condition is improving. That's all. Thank you.